Right, so our next presenter is Dr. Sugandha Dureja from CNETS India. Sugandha?
Good evening, I'm Dr. Sugandha Dureja from CNETS India, and this is the first, the chart that we were supposed to fill up. So I'll just spend a minute on this slide. We have almost everything available in India, except probably lanreotide, and I've put in figures there so you can see a comparison, a gross comparison to the cost. We have very low costs for most treatment in India, and the cost I've put in bracket is actually the cost a patient would have to pay in a public hospital, where most of the treatment is free, but that's a subsidized cost they'd pay for something like PRRT or a gallium scan, which is, they have to pay a little bit for it. And in a private hospital is the cost on the top, if you see, $3,800 USD for one cycle of PRRT, and just about $1,000 in a public hospital. So we have about 18 Dotanoc PET centers where we have availability of gallium Dotanoc PET CT in about 8 or 9 cities now, and we're still, it's growing rapidly, but then it is still very inadequate to serve about 1.25 billion of population. So CNETS India, we're in a very different kind of a social setting, and we have our own very different challenges that we face. And so I'll just briefly outline what we face when we work in terms of public health, or in terms of the level of policy making. There's lack of public health insurance in India. We're just about 30-35% insurance coverage. That's also private insurance, and about 65% expenditure done by the patients is out-of-pocket expenditure. That's OOP. And in the public health system, of course, we still have a very high burden of communicable diseases that we're fighting. So non-communicable disease, and that too a rare cancer, is very low on priority for the government and the health policymakers right now. Okay, that's on the larger scale that we probably will take a long time to fight out. At our organizational level, the kind of things we face on a daily basis is probably the first thing. The biggest challenge we have is a cultural or a social barrier towards patient engagement. Patients are not very forthcoming to disclose their disease status because of social barriers and issues that they do not want their identity with the disease to be known in public. Then India is such a huge country with multilingual states and multiple languages all over. So that is a barrier to communication, because there's no 1 or 2 or 3 languages that we can probably communicate in. We have about 20, 28, 5 languages that are the most common, and probably much more than that. So reaching out to patients becomes an issue. And illiteracy is a major problem, because a majority, about 50% of our population is illiterate. You cannot reach out to them with any form of media besides, I think, speech. There's no other form, or video, or some visual media. There's no other way to reach out to them. Then digital illiteracy is also a problem, because internet access is a problem. So people do not have access to internet, or those who have do not really know how to use internet for finding information. So that is an issue. And the perpetual issue that we're facing, the last one, is sourcing funds. We haven't really found a very solid source of funds till now. So what we've done so far, it's not that bad. We are supporting patients on one-to-one basis at the time of diagnosis, for guiding them to treatment, to the right centers, at least providing them information about the availability of doctors, centers, to whatever extent possible. We're getting queries on the internet, which is quite encouraging, even from bordering countries like Nepal and Pakistan also now. And what we've started doing now is we're just roping in interested contacts, whoever we know in different cities, and we're trying to create, decentralize the entire thing, and create, chapters in various cities. And of course, we've tried to create some buzz on Net Cancer Day activities, and we're hoping to continue it this year too. On the physician's end, just one moment. On the physician's end, we're trying to actually create a directory so that we can create a directory of centers of competence where we can ensure that a couple of basic services or someone with slightly higher experience with NET treatment will be available. And future plans, okay. So we're planning to now change the game plan and try to engage the patients through the physicians. If the patients are not directly interested in talking to us, we can probably try to engage them through physicians. This was just an idea that we are thinking on right now, just to, maybe as a pilot project, to start a certificate course capsule for doctors where they can be given a small online course and given a certification in NETs. That would probably raise the level of competence in doctors. That will be still a lot of things to be done about it, like course content and probably getting it certified from a medical body. And it will be targeted at multiple levels of doctors. So that's just about it. Thank you.
So we're way ahead of schedule. So you're doing this single-handedly, or how are you?
We're about 4 people. We're just about 4 people.
And how many patients are you?
Actually, indirect affiliates, like some patient's son who helps me, or some patient who's good with his ID who kind of helps with the ID stuff. So that way.
And you're a person skilled in from all over the country. Just 1.25 million people. No problem. Okay. Amazing. Thank you.